The call to action for health systems are, you guys, in ways that you've not experienced before. And I know you've heard that value-based care is coming and blah, blah, blah. But there are companies that are awesome, that are addressing the needs of the member, the employer who's paying for it. So healthcare executives ought to talk to the employers in their area. What do you need to keep your people happy and at work? Well, how can we partner? Go directly to the health system. Go directly to medical groups. Tell them what you need.
Welcome to the Healthcare Grind, formerly the Healthcare Hustle. We do what entrepreneurs often do and pivoted our podcast name in the first couple episodes because we realized someone else has that name, even though we did quite a bit of research. Oops. Regardless, this is still the podcast where we cut through the noise in the healthcare industry to bring you the latest trends, innovations, and insider insights. I'm Jess Harthcock, and I'm joined by my co-host, Lon Heck, as we embark on a journey to connect early-stage healthcare companies, payer executives, and investors with the knowledge and perspectives that matter most. Get ready to grind in the fast-paced realm of healthcare innovation. And for more advanced content, go to healthcaregrind.com.
Good afternoon, everyone. This is Lon Hecht. Welcome back to the podcast. I am joined by my co-host, Jessica Harthcock. Jess, say hello.
Hey, everybody. Thanks for joining us today.
Yes, thank you. And we have a great guest today, Marion Couch. We have great fortune to know Marion over the last several years. Jess and I both met Marion when she was the Chief Medical Officer of Cambia, and she is currently the CEO of IntoValue. And we have a great episode today to talk about value-based care, all things value-based care. So one thing is value-based care seems to be a catch-all and is used for so many different things. And I'd love to have Marion kind of level us up and explain what is value-based care and kind of what does it cover?
Yeah, thanks, Lon and Jess. I'm delighted to join you today, talking about one of my favorite topics. And if I could even level set, I think when you talk about making healthcare better, the plan A, B, and C is value-based care, and I don't really see any other real paths forward. So it's a movement. It's a journey. I think as part of that, it probably started with the Centers for Medicare and Medicaid Services when they put a stake down saying we're only going to pay for certain quality outcomes. They also then, as part of the Affordable Care Act, had the Innovation Center, so the CMMI, which has $1 billion annual budget, and they produce alternative payment models. So I think a lot of this work was born from the Centers for Medicare and Medicaid Services, and then it's sort of taken hold by commercial insurers and others. It means, Lon, different things to different people, but I think the best understanding of it, and the one I sort of use in the back of my mind, is this relationship. It's an equation, but it's a relationship. There's not values in it. Value equals improved outcomes, quality and access divided by cost. And so you want the best value for that service. You want the best value you can get for your patients and your members. The government programs such as Medicare and Medicaid have a much more well-defined set of measures, quality measures around it. And when you think about value-based care and the self-insured employer space, they really lean a little bit more to extend that to think about, okay, not only do we need quality measures and reduced costs and efficiencies, but we need great member experience. We need greatly improved access. We want concierge services. We just want better outcomes experience, lower costs, more efficiencies for what we're paying now. As someone who grew up in the fee-for-service world, at one point, I practiced surgery for 30 years. I was a head and neck surgeon, and I have so many lived experiences to share related to that. It's easy to think about transactional volume-driven things. And it's easy to live in a world where if I have a set of complications, I still get paid. You really start focusing on a better outcome, reducing complications, taking the time to do all those things, better experience, better access, making sure antibiotics are delivered, all these different things. If that's what you're rated on, if that's what you're paid for. So it's a really important movement. And I think I would say to those that are kind of like, well, what does value-based care? Tell me what else you want to do, because it's really clear that the fee-for-service world is not getting us to where we need to be. Costs are going up. And unless you think about a different way, which for me is having care delivery systems that are novel and innovative and putting payment models on top of them. When you think about that, then you can think about ways to improve healthcare. Without it, we're kind of just stuck.
Right. Makes a lot of sense. So why don't we step back for a second? Love to hear if you could give us a high-level background on yourself, just so the audience knows who we're connecting with today.
Yeah. Thanks, Lon. I have purposefully been on a journey to go from a healthcare provider, and was very proud of all my time taking care of people as a surgeon. And then I was a leader in academic health systems. I was the chairman of 2 departments, worked in their medical groups as a senior executive, was chairman of their medical group board. I spent time in CMS. I was the senior medical advisor to the administrator, which has got a $1.4 trillion budget and also serves 145 million Americans. Worked in the Innovation Center then. As you mentioned, I also spent time as a senior vice president and CMO of a large regional carrier and was really trying to promote value-based care while we were working together there. And then I've, in an effort to really put my money where my mouth is, if you believe in value-based care, where I'm leaning now is to extend value-based care across all lines of business, so that a health system or provider doesn't have different ways of treating different populations or different patients. So really interested in the commercial insurance / self-insured employer space, because they're actually quite progressive in thinking about it. And so, I think at some point you're going to ask me, okay, if I'm a health system or medical group, why should I care about value-based care? Let me tell you, through multiple administrations, CMS has not backed down from wanting to have all beneficiaries, 100% of Medicare and Medicare Advantage members in an alternative payment model, i.e. value-based care by 2030. And then they want 50% of Medicaid members in by 2030. And again, I don't see that changing. And so a lot of, especially health systems, are clinging to the fact that, my employer-sponsored insurance members who they cost shift to, they'll, supplement me as I sort of ignore it. They're very clearly wanting to lead into value-based care. They're very progressive, and they're tired of cost shifting, and they're tired of what is now an 8.5% annual increase in their premiums for not very good outcomes. So you have all the major stakeholders that I see leaning into this. Now, they don't know how to get there, and it's a journey and it's hard. But I would tell you the reason why we should always think about value-based care is all the indicators I see point to it as being a very important way to start thinking about, again, novel care delivery with payment structures on top of it to make healthcare better.
I love that. Marion, you mentioned kind of we're seeing a mandated shift in value-based care. Medicare, in my mind, has done a really good job of that in shifting to value-based care and being very innovative in the programs that they work with. Medicare Advantage contracts with a lot of different vendors to make sure that their members are experiencing superior outcomes. How do we think about Medicaid, who might be a little behind, shifting to that? And you mentioned employers thinking about that as well. Kind of talk to me about the gap between the two and how we potentially expedite that path for Medicaid and other lines of business to get to where kind of we are seeing the improved outcomes with Medicare today.
Yeah, the good news about that, and it's a great question, Jess, is that there's, at a very high level, there's a lot of reward for those that take a lot of risk. In other words, if you try to manage medically complex populations, for Medicare, Medicaid, there's a lot more reward in terms of tackling those groups. When we talk about Medicare and Medicare Advantage, we're really talking about a few programs that are run at a federal level. So across multiple states, they're the same. So For Medicare, you have Medicare Shared Savings Program, which is run by Medicare. And then you have a number of models coming out of the Innovation Center, CMMI. And those are things such as ACO REACH and others. And again, there's specialty bundles. And the nice thing about those is they're administered nationally, so you can go across different states. And they are a nice place to start your value-based care journey because they allow you to accurately code and document so that you have risk adjustment. And so with risk adjustment, it is a source of revenue for these organizations that are assuming risk. And so there's a lot of interest in MSSP, the Shared Savings Program, and the Innovation Center. When you think about Medicare Advantage, that's run by commercial insurers. And so that's sort of dictated by whether you're in their network or not. The harder thing, Jess, is that Medicaid is often administered at the state level. It is administered at the state level. And so there's a lot of variation in how different states think about it. The great news is if you think about the dually eligible Medicare, Medicaid population, there's some really good special needs programs that will let you really benefit from excellent care management for those members. When you think about managed care and the Medicaid population, it's a nice way to think about social services and other things that influence your health. And it's a way to think about getting them paid for. So for a state to think about managed Medicaid and to think about, okay, these are my dollars that I have. How can I amplify their impact? The value-based care route is a ton of sense for them. They again have these managed Medicaid programs. They can innovate. They can think about improved and different access. And again, reaching out often with partners into the community to think about what socially related health needs their members have and how to address them. These are huge, great innovations that I'm thrilled to see. We weren't talking about those types of things, but I would say even 5 years ago. We know there's a return on investment, and we know that there are dollars to be gained, especially if you do it well. Again, the more complex and higher the complication of these populations, the more reward there is for you. So it's a state-by-state thing with Medicaid, which is why I think you're not seeing sort of more of a movement, but some really smart people are understanding that Medicaid's a nice patient population. And my goodness, that is a noble place to work, right? There's a challenging group of people, and it's time for that to happen. But I see a lot of interest in value-based care in the Medicaid populations now.
So you mentioned getting there for value-based care. I think by like 2030. What is there? What does there look like? And then the other question that I'll say, just to kind of set you up with it, is we have a lot of earlier stage founders on this podcast. What are ways to kind of dip your toe in the water and get started in a value-based construct that can be valuable to payers and others, that kind of gets you on that path? And then we can talk about how you iterate from there. But so what is there? And then what are some basic ways to kind of get yourself into that mindset?
Thanks, Lon. I think it's important to understand that, to me, healthcare is not like any other business that I know. It's just not. And so bring your business acumen, but don't be frustrated if it's more complex and more inane than you could ever imagine. It just is. And make sure that as you build out your team, you build out people that have experience in these different sectors, because it is complex. And if you pull one thread here, be expecting another thread to kind of, follow in a place you didn't expect it. So everybody wants to get into healthcare, and I'm happy about that. But it is, to me, it really is like a different industry. So yay, come think about it, join the bandwagon. There's lots of new opportunities, but I would say the most important piece of advice, and then I'll answer your question. If you're wanting, as a young startup or an established company, to tackle healthcare, think about where it's going. Think about what the trends will be in 3 to 4 years. That's the way you can best enter. And do not forget that we are in the age of AI, and that is phenomenal. Oh my gosh, the rapidity of the changes that we'll see now is just going to accelerate. Thinking about the right use cases to help in healthcare will be really important. So we'll see a lot of iterations, but think ahead, like where the puck's going to go, so to speak. So let me then answer your question. Value-based care is a journey. And I remember 10 years ago, we had a good population health program at one of the academic medical centers I was at. And we'd report out, Lon, on all these quality measurements and all these cost measures. And I would follow them closely. And then we sort of talk about it, we move on. The problem with that is it felt like gambling to a physician in a medical group. In other words, you'd adjudicate and report on a case or a patient you saw sometimes 18 months later. And so there was no ability to iterate or learn. You just got reports and you kind of went, oh, good, I did good there. And I have no idea why I didn't do good there. It so felt wrong to assume risk and to have this gamble that what I was doing, that I would learn about whether it was successful 12 to 18 months later, was going to be something that was a sustainable care delivery model for me. So for me, what's really happened is the thought about managing populations of people, thinking about bringing programs that will help certain populations, and maybe leaning in, and this is great for health equity, to have more focus on people who need more help to get their health in sort of an equal way. That's how I roughly think about health equity. These population health concepts were always there, but what really supercharged it and is going to make it successful, and where a ton of opportunity is in the data analytics realm. In other words, bringing almost real-time actionable insights to the health system, the medical groups, and down to the individual clinician level about the individual member/patient is what's going to make us better and able to do these things. And it was such an epiphany for me to understand that. So the ability for enablement companies, and I'll define what that is in just a minute, and health systems and medical groups that have teams that are transforming, though they hate the word, but I'll use it on this podcast, transforming their care delivery, marrying that with their tracking their quality outcomes, their performance outcomes, their total cost of care, and then these other measures such as access and member experience. Being able to iterate and improve on that is really setting value-based care up to succeed going forward. So when you're an investor thinking about how you can help with different populations or different stakeholders to move that forward, the game plan is relatively the same. There is some variation across different lines of business. So there's opportunities that differ across the different lines of business. But I'm answering it that way because I feel we're at a moment in time where we can really now begin to accelerate the adoption of value-based care. I'll finish by saying I was speaking in an earlier call today with a senior level person in their accountable care organization. And Jane was saying that her health system was about 50% fee for service and then 50% value-based care. And
that's actually really great.
Correct. But to tip that, tip as fast as you can into value-based care is my advice to everybody. I think all data shows that it's the future. And again, to tip when you're at that point or sooner into value-based care really will make a lot of sense to these organizations.
So, 50-50 is really great. I feel like a lot of the organizations I'm seeing are more like 5-95, where very, very little are in there. So what is kind of the end game? Like if you look at a value-based construct that kind of gets us where we want to be, what does that look like? And then the next thing is, how do you help our listeners figure out how to dip their toe in the water in value-based care so that they can start aligning more to value with their customers?
Yeah. So Lon, a lot of value-based care again goes back to population health. And don't let me finish this podcast without defining enablement companies. I've used that term twice now. But you're going back to holistic, whole person care with value-based care. And again, that's the basis of population health management. So you have great primary care. And it turns out that independent primary care groups are probably going to be a lot more willing and able to deliver on that than academic medical centers and some health systems, because some academic medical centers and many health systems are 95% specialists. So what there looks like is you have a great primary care foundation, and you have excellent referral management, condition-based specialty models with your high-value specialists. And there's different strategies to do that. But there looks like, again, a bigger investment in primary care. So you can do whole person preventive care. You can serve that person in a way that marries behavioral health, their social needs, health needs, and, some basic primary care with parsimonious use of specialists. So that's there and it works. There's a study out of Oregon that shows what they called advanced primary care, which is what many of the self-insured employers like to think of as population health and value-based care, a 12-to-1 ROI line, 12-to-1. And you can imagine as a person, wouldn't it be great if all of us had an excellent primary care team? I'm going to tell you right now, I don't have that. I almost never do. But that's what I think the members want. That feels good. It just makes sense. But it's hard because we've got this perverse world where a lot of health systems, multi-specialty groups, and academic medical centers are predominantly specialists. And so in the fee-for-service world, they're revenue generators. In the value-based world, they're cost centers. So helping them
That's a good point.
switch into that. And again, let me then also say that, if an academic medical center and a large health system doesn't embrace this, right now, what I'm seeing are so many great startups and established companies and self-insured employers and folks, they're not going to stand for it anymore. They're going to eat away. They're going to go around them. They're no longer the 800-pound gorilla in the room. So academic medical centers and large health systems that ignore this will be able to still do acute care, urgent care, emergency care, complex surgeries like bariatric and transplant. But they'll be focused factories of acute care. And all this other stuff will be peeled away because it's not affordable. It's not got good access. It's not got the things that the members and these populations need. So they do that at their own danger, that, they do that at their own peril. So great value-based care is a holistic approach, Lon. It helps lower utilization because you've got referrals to high value physicians. You're making sure you use less intensive treatments, not just surgery. Right now, we don't have the checks and balances in our system. And I would say actually, you almost get rewarded in the current non-value-based care fee-for-service world. In the fee-for-service world, man, open the door and just refer away, operate away. It honestly, it feels like that. It does feel like that in the straight fee-for-service world. So for me, the ultimate answer is value-based care feels right as a physician. It feels like what I trained and what I went into medicine to do.
That's awesome. Can you give me an example? So if I'm a hospital system or a large medical group and I say, I know I want to get into value-based system. I know this is our future. I don't know how to do it. Do I start to develop that strategy by myself? Do I outsource this or do I go to certain vendors that are taking risk that can help me do that? What's the easiest way to start?
So, a couple of things. It's great that they're even having that conversation and they're acknowledging the need to have that conversation. And I think having a clear message from leadership that you're going to go forward on the journey because you're not going to get there overnight. Nothing about this is easy, but that's where we are in healthcare. Nothing in healthcare is easy, just for the record. So this will help me better answer Lon's question about how startups can think about it. First, you have to have the will. Then you have to have the knowledge. You have to have a strategic plan on how you're going to go forward. And you've got to be savvy, right? You're not going to stay in a leadership role if you do wipe out your revenue streams as you, again, your revenue services are going to kind of tip into your cost centers. So you've got to make that transition. So you've got to be thoughtful. And I would say having a strategic plan building out on the foundations of data analytics platform and the ability then to hire or build networks around a primary care foundation. And then think about how you are going to have excellent precision referrals to the right person with a high value way that keeps your hospital whole and solvent, your health system whole and solvent, your multi-specialty group whole and solvent. These are the types of things you need to think about. And now I'll answer something I've wanted to. The enablement companies, Jess, are an example of how people can partner and almost vendor out this. Number one, they are experts in this. They are what venture capital and private equity feel is the way that we're going to scale value-based care across the nation. And there's a recent beautiful article by, they're my friends, so I'm going to shamelessly plug them, the Levitt partners, Spencer Morrison and Kate Delisle, who with the Arnold Fund as a research funder, they did a beautiful white paper on about 145 enablement companies to show what they do and define it. And so coming up to speed on that is important. So these enablement companies, as an example, Jess, of how you could partner with someone, they would give you your population health software. They would do some consulting for you to help you with your strategic plan. They would assume risk for you. They would help you go forward because a lot of health systems don't have reserves coming out of the pandemic, and medical groups almost certainly don't. That was epic what they endured during the pandemic. So they help you with these major obstacles. They help you with change management. They help you set up the joint operating committees that you'll need to do practice. And they hate the word transformation, but that's what it is. To think about care teams, different ways of practicing. And so these, as an example, these enablement companies will help you think about immediately plugging in and going with experts, people who help you assume risk, giving you the data analytics, reportable insights generation that you need to iterate and move forward. The downside of that, Jess, and the reason why some health systems will want to do it on their own is in exchange for that help, they'll take 50 to 65, 70% of your shared savings. So, thinking about, the balance of that's going to be important. Where vendors and entrepreneurs and innovation can help is asking big questions around value-based care. How can I better engage my members, my patients? How can I keep them out of the hospital with, machine learning so that every time they call and ask a question, I'm learning about them? How can I get daily engagement with them? How can I answer their questions, help them with a referral, care navigation, build healthy behaviors? So let them know their wellness benefits. So engagement's a big piece. Hospital at home, almost hospital level care at home is a huge thing. And oh my gosh, the complications that you endure by being in even highly reliable health systems, it's so much better for members to be at home. Thinking about people going to check on someone so they don't have to go to the urgent care or emergency department. These are things where really creative vendors have innovated in that space and continue to innovate. And then you get into specialty care, and I'll stop after this so you can ask and make sure I'm heading in the right direction for you. But, think about maternal care, think about women's health, think about wonderful innovations in helping a sleep-deprived single mom with 2 other kids connect with her pediatrician and her obstetrician. Think about making sure that we have line of sight on them to keep them safe and healthy and get them what they need. There's tons of innovation now. And again, the AI use cases, which is the most potentially exciting part about this, that can be brought in to help health systems. Some of the use cases are super staffing, where instead of a person calling about Lon who just had his knee replaced, I have a chat robot who, by the way, is 10 times more effective and empathetic than Marion calling. But they just want, if Lon wants to talk about his cat and his dog, they'll talk to you about it, but they'll find out if Lon's got his medicine, if he's happy, if he's got a fever, and then they report that back. There's so many exciting potential use cases as part of this. And so I hope there'll be great partnership with health systems as medical medical groups as they lean into this with these innovators, because that's the beauty of living in this age.
Marion, you mentioned, sorry, Jess, did you have a comment?
Go ahead.
Okay. You mentioned why can't I think of the name of them? The enablers. Can you give us maybe 3 or 4 examples, just a couple of names of enablers, in case the audience wants to go and check them out?
Yep. Aledade has been a giant, and really brilliant people who came from CMS, by the way, and also the Health Department of New York State. But they've been around, and they're expanding rapidly. But they started out by aggregating independent primary care practices to be able to assume risk, and so they've been a strong leader. I think everyone would think about Agilon, who has really been partnering as well. And again, as their some of the margins get tighter, these companies have issues. And so these companies are constantly iterating. But I always say Aledade, Agilon, there's Pearl, there's Privia. There's a whole bunch of really impressive ones. And again, there's if you Google, there's these great resources to give you a very concise review that covers it much better than I just did.
Really, really appreciate that. So when you think about our audience, what are ways that they can get into a value-based construct? Like, maybe we'll just take an example vendor. And Marion, I'm happy for you to pick that, or we can. I mean, we could pick something along the lines of, I feel like it's easier when you pick something that's like a kidney type of vendor or a chronic condition vendor that takes full capitation. I feel like that's a pretty easy model to get into. But let's take something that's a little harder, like maybe like a telemedicine vendor or something like that. Are there ways for them to get into the value-based care construct? Is it as simple as charging a rate with upside and downside with endpoints, for quality and things like that? Or, can you give us some insight into that? I'd love for the audience to understand that a little better.
Yeah. Lon, I'm going to say something that's a little controversial, but it's born from my experience at the large regional insurer I was at, and also, decades of experience in a health system. Sometimes these very defined companies that have very defined solutions, what we call point solutions, they prevent a health system or a large medical group or an employer from really getting that 12-to-1 ROI on advanced primary care. In other words, if I am contracted with a large medical group, but I have someone who's handling their chronic care management, I have someone who I've contracted to handle their kidney care management, we take these high-risk, complex patients out of that population. That medical group can't garner the cost savings and rewards from value-based care because I'm paying these other point solutions. So I would someone called it point solution.
I remember that. Yeah,
piranhas,
that was at a conference a couple of years back. Yeah,
they eat away at your
capitation. I think it was capitation piranha or something like that. Yep.
Right. I think that's just something to keep in mind. And it was a hard lesson for me to learn because in one of my roles, I really wanted to reward a group that was going to take total holistic care of my population and be responsible for it. And their positions were ready to go. They were building their own solutions. But because I had contracted with other groups, the numbers no longer work. So beware of too many point solutions. Again, it's a little controversial what I just said, but I hope it's helpful to the viewers. So to answer your question, think about now how I've got advanced primary care, how I've got these, but what's outside of it? What's outside of it that I can really accept and address? And so I think a great example of that is companies that are looking at elderly or underserved populations that can't get in to see that healthcare system. They're in rural America. So do you give them a tablet or something so that they can communicate better. And then you're helping with that referral management to get them in. Companies like that, to me, are examples of how you can add to the ecosystem. So you've got to spend time, Lon, to really answer your question. If you're an entrepreneur, talk to people who can help you understand the totality of value-based care now, and think about what the pain points are to add value around that. I think that's the best way to approach value-based care. So for me, a lot of that is thinking about companies, or let me say it differently, to think about a product that would keep people out of the ER, especially if you're on the hook for the total cost of care. Thinking about keeping them at home because that is just better for everybody. You're going to have better outcomes at lower cost of care. Member engagement is sort of over that, and no one's doing that well. Again, that reaching them to healthy behaviors. There's a wonderful group of companies, and I think there's more innovations. How do you connect your members, your populations with the community and make sure they have resources and what they need? There's so much innovation that's going to go on in that space. And that's sort of beyond what I think is sort of advanced primary care. So that's how I think an entrepreneur in a company ought to think about it. Again, and you layer on AI use cases and the use of machine learning and AI to make this all more efficient, lower everyone's operating costs. It's really quite exciting, and there's lots to do. I would leave this group with the call to action. There's still tons to do.
Yeah,
I love that. Good call to action. I know we're getting close on time, so we're going to have to wrap here soon. What is your advice for those listeners out there? If you had to choose 3 different call to actions, maybe for healthcare systems, for those entrepreneurs, for investors, I'm going to add one more, and for healthcare executives, what does that look like? What do we need to focus on next?
Yeah. Like most human beings, I'm going to probably lose you after the third one. So remind me, just this one I forgot. When you have like more than 3 kids, you forget their names. So the call to action for health systems are, you guys, in ways that you've not experienced before. And I know you've heard that value-based care is coming and blah, blah, blah. But there are companies that are awesome, that are addressing the needs of the member, the employer who's paying for it. They're able to help with what CMS is dictating. They're out there, and they'd love to take care of your patients that you're not addressing. So, if all I can promise you is that you need to change, and I would strongly recommend you consider the journey on value-based care. You don't have to have an answer for everything, but you have to know that you're going to change. You can't stay where you are in the fee-for-service world. No, in my world, I'm very in tune with what self-insured employers are considering. And an 8.5% increase with already high deductible plans, there's a point at which that breaks the country. And again, you're paying, your cost shifting for hospitals. You're paying 200% higher than what Medicare is paying. That doesn't work. It's past time. So health systems, I think they need to understand that. And so the last one, health executives, if they don't understand what's going on, they need to reach out and build a team that does. And again, it's just important to reach out into the community. Maybe go, honestly, Lon, you'll appreciate me saying this, go past the insurer that you always deal with and talk to different partners in your community. So healthcare executives ought to talk to the employers in their area. What do you need to keep your people happy and at work? Well, how can we partner? New partnerships is what I would say to these health system executives. If you're a self-insured employer, again, go directly to the health system. Go directly to medical groups. Tell them what you need. Contract. There's nothing preventing you from doing that. And by the way, I'm going to say something. I have great respect for the insurance industry, but they're not moving fast enough. They're not. And so new partnerships might cause a little competition, which might be healthy. And then again, Jess, I forgot the third one. Is it member? For member, maybe I'll answer that and then ask. Members, they deserve better access, affordability, better outcomes, a team that cares and can reach out beyond the once every year appointment. That's what healthcare feels like it should be. And that's what I think value-based care will deliver on.
Awesome. Okay. So I know we're getting close to time. Marion, quickly, can you let us know how can viewers get in touch with you if you have questions? Why don't you share your website? And then is LinkedIn the best way to reach out?
Yeah. LinkedIn is great. Yep. That's actually the best way. If you don't mind, Lon, I love my website, but I never look at it because I have 6 emails and, like you and Jess. So LinkedIn is something I kind of wake up in the morning and end the day with. So please reach out via LinkedIn and DM me. I'd love to speak with your audience. And I appreciate your having me on. This has been so much fun.
We really appreciate it. You've been fantastic. We're going to wrap up this episode. Thank you all for tuning in. If you have topics you would like for us to cover, hit us on LinkedIn as well, Lon Hecht and Jessica Hearthcock, and we'd be happy to spin up some additional episodes. So, Marion, thanks so much for joining us. We really appreciate it. Everyone have a great day. Thank you.
Pleasure.
Thanks, Marion.
Thanks for having me.
As we wrap up this episode of the Healthcare Grind, we want to thank you, our incredible audience, for tuning in. If you found today's insights valuable, don't forget to hit subscribe and leave a review on your preferred podcast platform. Your feedback fuels our grind. For more exclusive content and updates, visit our website, healthcaregrind.com. Until next time, keep grinding, stay informed, and lead the charge in shaping the future of healthcare. This is Jess and Lon signing off from the Healthcare Grind.